This is the Optimus. This will come loaded on the Optimus Max. The new Lumecca Peak is not white anymore. It's all black, like the Death Star, Darth Vader, IPL, nuking the entire universe. You've got a lot of options, your Optimus Max. You're going to pick what you want here. This will be a Lumecca Peak. Up comes a number of settings parameters. This is the older Optimus. The Optimus Max is what we'll be launching in the next 8 weeks or so. What happens on your Optimus Max is you get to select your energy, and typically, if I'm using 12 on the Lumecca, I'll be using about 8 to 10 on the Lumecca Peak. Normal is about 8 degrees Celsius, strong is 5 degrees Celsius on this water-cooled sapphire tip. We can see it's kind of greenish, yellowish, because we're using green wavelength, 515 cutoff. And then we want to go to pulse mode, which is fast 1 pulse per second. So 12 joules, strong cooling. What does short pulse width mean? You only have 2 options here, short and long. And those that have been with Dr. Crendell's IPL for a long time, you've seen that in about from 2001 or 2 to 2015, he allowed doctors and users to select the pulse duration. Now, you don't get to select it. The pulse duration is tied to the fluence, and you get 2 options. In long pulse duration, it is going to be 1/2 of the fluence. So if I have 12 and I want long pulse, that's going to be 6 milliseconds. 6 milliseconds is much shorter than the closest competitor at 10 milliseconds. So even that is a nice aggressive pulse duration. Now, what happens if I go to short? Short pulse duration is 1/3 of the fluence in milliseconds. So I have 12 of energy and I have a short pulse duration, I'm going to get 4 milliseconds. 4 milliseconds. If I go down to 9, I'm at 3 milliseconds. If I go down to 6, I'm at 2 milliseconds. So as the power goes down, the pulse duration gets shorter to maintain as much of that peak power density, which is pulse duration times energy. Remember with pico, when you're removing pigment, you're in the picosecond pulse duration and you have less than a joule of energy and you still get rid of pigment. So pulse duration is just as important as energy and they work together. Dr. Crendell, who is the inventor of IPL, realizes that, and he integrates the length of the pulse duration with the fluence in short as well as long pulse. So let's go to typical, this would be the kind of energy I would use on the peak, which would be about 8 joules, short pulse duration, and we are going to be in that 2.3 milliseconds or something like that, which is going to be very short pulse duration. And now we go to our patient, and let's move over here, Chris. I've got my water-cooled sapphire tip. I'm going to do some test spot here. Do a few pulses on the side of the cheek, not on the nose or the chin. If you get a blister, make it on the side of the face, for goodness sakes. I do 5 test spots, look for an endpoint. The endpoint is erythema, edema, but no epidermolysis. So I put my foot on the pedal, I put my skin on stretch, and I go pulse 1, 2, 3, 4, 5, 6. I'm overlapping about 20%. Zoom in, Chris, one more time. Skin on stretch. Pulse 1, 2, 3, 4, 5, 6. Then I clean that off with my tongue depressor and I watch for about 5 minutes. And I look for the erythema, edema, no epidermolysis or a Nikolsky sign. And she's got very nice erythema starting there. I also look for melanin effect, which is melanin changing its conformation, looking darker, and a little sludging in small vessels. You do the entire face, overlapping 20%, brow, under eye, lateral face, mid-face, chin, and then you do the other side. On average, 20% overlap. A good photofacial should be 180 to 220 pulses, depending on the side of the face. Look at the chest, neck, and décolleté in hand and offer bundled treatments off the face, and always go down 2 joules per centimeter squared off the face. 3 treatment protocol, overlap 20%. We're going to hand this off to Shelby, who is my PA, my physician's assistant. Tomorrow when I do this injectable facelift, which is super cool. I do half, Shelby does half. To show you, you don't need to be a facelift plastic surgeon to do these things. You can do a non-excisional facelift like tomorrow, which I would do in my home base with the Quantum RF10, the Morpheus, toxin filler, and a PDO Max in about an hour. We're going to show that tomorrow. With the kind of Morpheus energy, you're going, holy crap, how does he get away with that? It's called local anesthesia and a craniofacial block. A little bit of nitrous oxide from me, not the patient. And so we're going to do that tomorrow. IPL is always part of that package. Got to make that skin look brilliant. You can often do that in a single session. Now, because you often need 3 Morpheuses or 3 Formas, we'll throw 3 photofacials in there, but you can get, as a single photofacial, I'll often say, let's do your brown spots, probably single treatment, and we charge $1,500. It used to be $1,500 for 3. That's the power of power. That's the power of pulse duration. Let's go back to the clinical slides now while Shelby catches up. So, what are we treating here? I really don't like wrinkles and laxity, but I hate discoloration. I like beautiful skin. I don't care if it's saggy, but it should be shiny. Shiny and saggy is better than discolored and saggy, no question. And lifted, smooth, tucked, and shiny is the best of all, but everybody wants beautiful skin. They don't all want surgery. And so this is single treatment Lumecca. Look at all that dyschromia, gone. Now, if you saw her submentum, I did face tight submentum. Now you can do the Quantum RF10, and she got a great submental result. Screw the submentum. Look at her skin. It looks like 20 years younger in a single treatment. That would be Pico-esque. Most other IPLs cannot get that done in a single treatment. Décolleté. Don't forget the décolleté back of hands. There's acres and acres of unattractive skin off the face. And so every time I see a patient, I always have a nurse in the room because God knows patients are crazy, right? So I always have a patient as my crazy barometer and testimonial witness that Dr. Mulholland is very professional. Because I will say, okay, ma'am, show me your décolleté. You know, don't be creepy, but you show me your décolleté and the back of your hand. And then this works every time. I always look at it and I look shocked. So look, and you go, and then you got to go back like in shocked disbelief at that discoloration, and then you have to cluck and go. I don't think I've ever seen skin that mismatched. Your face you've been looking after looks pretty good. You need photofacial, but OMG, your décolleté looks like The Walking Dead season 3. We have to treat that skin, the back of your hands. You can't walk around like Tales of the Crypt because they're going to blame me. They're going to look at your face. It looks extraordinary. Little toxin, little fillers, suture suspension, Morpheus Quantum. You're going to look 10 years younger. But your chest looks terrible. So you know what? I feel so badly for your décolleté and I'm going to throw the damn thing in there. But be cautious. Off the face, the dermis is not so thick. Whatever you're doing on the face, 20% less, 2 joules less on the body. Look at that chest. I'm doing her face, but look at that chest. She's not even 30. That is bad sun damage. Now, she comes back. It looks horrific. You got to warn them. I show them these photos because where's she going to go? Show her friends. Oh, Dr. Mulholland burned you. That's going to be a scar. No, it's just a good treatment, not a scar. Then she goes to some other competitor. Oh, yeah, Dr. Mulholland, he's a cowboy. That's going to be a scar. I'll look after it for you. What does he do? Nothing but Aquaphor. See, I cured you. It's going to fall off. It's going to desquamate. But if I don't overlap enough, I'm going to get tiger striping. Then they think they do have a scar. Oh, look at all these white scars. No, that's actually nice skin. The crappy skin's still there because I didn't do a good job. Overlap 20% and pie crust. So go one way, the other way on the décolleté, neck, and the hand. And that's her with the melanin effect at 3 days, and here's her at 6 weeks. Single treatment. Single treatment. So show them this so they go, oh, what's that? That's a good result, ma'am. And you start here, you do a single treatment, and you end up there. So, beautiful skin is a beautiful thing. And you need an IPL to get that beautiful skin. Rosacea, vessels are much harder to treat. This is why it's nice to have that very short pulse duration and that Lumecca peak, because that is with very few treatments and no purpura. But you got to be cautious. If you use short pulse duration and 8 or 9 joules, that's like my Profective E-beam. I can get purpura, and purpura lasts for a couple weeks. Patients do not like it. So make sure you use subpurpuric settings. I'd rather treat them 2 or 3 times and not get purpura than treat once and get purpura the last 2 weeks. Purpura is like broken blood vessels and they bruise everywhere. The Lumecca is that strong. Got to be cautious. And so treating hemoglobin is often a little more challenging. Now here's a gal I did a nose job on, ENTM plastic, so I did a lot of nose jobs for 25 years. Her nose looks great, but look at her skin. Wow, that's a single photofacial on the table. Got a lot of erythematous, rosacea, acneiform kind of eruptions. Why do millennials want to ruin a $10,000 nose job with a nose ring? I have no idea, but her skin looks great. Her nose looks better, but her skin looks great. In fact, you could argue the skin looks better than the nose job. The skin looks awesome. So if you're a surgeon or you're doing other services, Morpheus, Forma, hair removal, bundle things like beautiful skin. And IPL is for beautiful skin, and this is the best IPL on the market, bar none. Again, telangiectasia, diffuse erythema, rosacea, try not to get purpura. It's great for these types of vascular paths. I showed her before. The treatment itself is pretty straightforward. However, be careful, especially in the Southwest, because they're going to have sun exposure. They got sensitization. So every time they come back, we always ask 3 or 4 questions. Number 1, have you been in the sun more than 4 hours since the last treatment? And when I say 4 hours, don't say, have you been tanning? Oh, no, I don't tan, but I golfed 18 holes. Sun exposure, without sunblock, those melanocytes, those cells are more sensitized. And what you think will work will be way too aggressive. So have you been in the sun? Have you received a new medication in the last few weeks since your last treatment? Because they might have had a UTI, get on a sulfonamide, and be photosensitized. And what worked at 8, 9, 10 joules, they blow up like a tomato or get blisters and a scar. So have you been in the sun? Have you been photosensitized? Have you seen any improvements? Did you turn brownish and desquamate? Did you get any bruising? Adjust the centers if they did. And I always write down, have you seen improvements? Oh yeah, I see my skin is better. Has anyone commented? I write, yeah, she's getting comments on her skin looking better. And then typically, I'm going to go up 1 to 2 joules per centimeter squared each visit and keep the same pulse duration. So if I start at 8, this next one's at 10. If I do 10, second to third, and last is at 12. Now, if they come back and they look awesome, like that woman's chest, we're done. So I'm more apt to sell bundles of IPL with 3 Morpheus and Forma and single IPLs because they get such a good result. And I tell them, it's like a Pico pulse dye hybrid. I charge more for one, but you may only need one. Other centers are going to charge you 3, 4, or 5 treatments and get less than I can get with a single treatment with this product. And so skin type 4 and 5, what do? I never use the 515. I start with the 580. I always pre-treat them with a lightening regime. I don't say bleaching because they think of, the man from Glad and bleach. They think of Trump and COVID. So I just say, look, it's a lightening regime, and it's not going to cure your dyschromia or melasma. It's going to minimize the risk of having reactive hyperpigmentation. So I get them on like a 12% hydroquinone, maybe a 5-6% ascorbic acid, a 4 to 6% kojic acid, and I put them on 3 times a week for 3 weeks, and then every second day for 2 weeks, and then we do the treatment. And then I wait 2 days, start it again, and they stop 2 days before the next treatment. So they treat it intercurrent, and then I gradually ramp them up before, and I gradually slow them down after. I don't want them on hydrocone forever. Hydrocone will give them ornicosis. I want them like grayish skin. I want them off it. And maybe they can use some lightening regime from your skincare line without hydroquinone forever. But treat 4 and 5s a bit different than 1s, 2s, and 3s that are reds and browns. And so watch out for melasma, watch out for hyperpigmentation. And so you can treat these patients with the 580 and get brilliantly luminescent skin. But if you're not careful, you'll make their melasma or their dyschromia way worse. You get a good treatment, turns dark, they peel off, you go, wow, you look awesome. 6 weeks later, they're twice as dark as when they started. Now it takes you a year to get them back to where their baseline was. So be very cautious on 4s and 5s. 580, bleach them, low energy, sneak up on it. Don't treat it too traumatically. And again, you get quite a disquamation on Hispanic and Asian skin. Just make sure you pre-treat it. And so you look at all of this, you go, OMG, man, this is like my entire med spa. If I had skincare, toxin, and filler, I'm done. I'm ready to go. I've got 6 or 7 revenue streams, which is why no other company would put a high-speed, 3-wavelength thermal system on the same system gives you a Morpheus, a Forma, a long pulse YAG, and great IPL. This is crazy. And you can modularize. You don't need to buy out of them. Just get the ones that work. And so combination therapy is common. If they're going to sell skin color correction, Lumecca, sure, they're going to listen to the Morpheus Forma combo, 3 treatments, once a month, once every 6 weeks for best-in-class reduction. And so these kind of results, this is a gal who has got a lot of deflation, descent, and deterioration. So we would have taught her about volume. I mean, she's got temporal hollows like Tales of the Crypt. So you'd probably say, ma'am, you've had a lot of facial fat loss. We're going to add a little bit of tweak to your temples. Oh, I don't want filler. Okay, but educate them. Get them to the top of the ladder in education. They'll often come back once they trust you. Say, ma'am, you want to know what I think? I know you came in thinking microdermabrasion, but here's what I would do. Color correction, I show them where color correction would help. A little bit of wrinkle reduction and tightening, show them where. And you see these temples are kind of hollow. Oh yeah, I was kind of thinking about that, but I heard fillers were scary and dangerous. Well, maybe in other parts, but not here. I'd put a little filler there, but you know what? Sounds like you're not ready. Let's do the photofacial, we'll do the Forma, and we'll do the Morpheus. If you like it, we can do filler at the end, once you trust us. And so don't be over salesy, be educational. And let the patient buy. Let the patient get sold what's best for them. That's called highest ASP top of ladder selling. And so she comes back after her treatments. Her skin looks awesome. She still looks a bit cadaveric, and I wouldn't use that term. Ma'am, you're looking a bit cadaveric. I would say you look a little like you've lost some volume. You want to bring that fullness of youth back without filler face. And she might now trust me because her skin's looking great, and she might acknowledge her temples look a little hollow, under eye looks a little sunken. Again, energy-based combination. Look at what the Morpheus does to the cheek. That's with no filler. That's Forma Morpheus, getting the volume. Didn't help as much in volume under her eye, but her cheek looked awesome, and the color correction of dyschromia looks great. Here's the gal who got bundled on higher on the ladder. In a single session, I did photofacial, Morpheus, toxin, and filler. And this is her about 2 weeks later. The lips are maybe a little overdone. She's got that Diablo Jack Nicholson brow, little over elevated. Try taking those down in some women. And I think, you know, overall though, for a single session color correction volumization with toxin, Morpheus, and IPL, combination therapy works.